Good morning. Good morning. I hope you guys didn't think I abandoned you. I just had a long weekend of trauma call, and couldn't get to it yesterday. I want to get back to my daily tidbits on behalf of Patient Choice and Chemin. What do I want to talk about this morning? I want to talk about angina. You could say angina, right? The term is angina pectoris. It's not just chest pain, but it's chest pain or discomfort caused by lack of blood flow to the muscles of the heart, what's called myocardial ischemia. Okay, and it has to do with the lack of oxygen or decreased amount of oxygen supplied to the muscles of the heart. And that's usually associated with what's called a coronary artery disease. I'm sure you've heard that. These are the arteries on the heart, right? And that whole idea of coronary artery disease causing heart attacks and things like that is the leading cause of death worldwide, all right? So remember, angina is not a disease in of itself, but it's really a clinical syndrome. It's signaling something else that's going on, right? And a lot of people, it's very prevalent across the globe, all right? Millions and millions of people. And there's certain risk factors: hypertension, high blood pressure, diabetes, high cholesterol, smoking, being morbidly obese with sedentary lifestyle, chronic kidney disease, and a family history. And that part is important, right? A lot of people don't realize there is a familial component to this. This, no matter what you do. I've seen some healthy-looking folks, etc., still end up with these problems. And this is interesting because it's more common after the age of 45 in men and after menopause in women. So men typically present earlier, but women often have what's called atypical symptoms and higher mortality because it's underdiagnosed in women. Take note of that, all right? So it's really this, pressure feeling, right? You feel it, it's like a spasm in your chest, and it's due to the atherosclerosis, which is the narrowing of your coronary arteries by plaque, all right? And you could also have what's called vasospasm, where the vessel itself just spasms. It's temporary constriction, and you could have that also. All right. So again, I want to emphasize that it's chest pain or chest discomfort, the pressure, the heaviness, the squeezing, even a burning sensation behind your sternum. Okay. All right. And then it may radiate. It may radiate down your left arm. It can radiate up to your jaw, your back, and also your what's called the epigastrium, upper belly right there. All right. Stress. What triggers this? Stress, heavy meals, exertion. All right. Those who have been seeing the doctor and made the diagnosis, they have been given nitroglycerin. They pop it under the tongue, and if it resolves with that, you know that it's angina, right? Now, there's something called atypical angina, and this is more common in women, elderly patients, and diabetics. Shortness of breath, fatigue, nausea, right? So it's not that classic tightness in your chest. It's very vague. You may get a little short of breath. You may feel a little tired. You may get nauseated, right? But still have that suspicion that it's underlying angina secondary to your heart. All right? It can get to the point where it becomes so unstable that you're having chest pain at rest, just sitting there. Right? So that increases your risk of a heart attack, the myocardial infarction. You need to go see a doctor. You need to let your family know that you have it, just in case you have, an episode. They understand what's going on, right? History and physical exam is so important when you see your doctor Tell them exactly what's going on. An EKG or ECG can be done, right? And that can show the physician or the tech certain things on the EKG to make that diagnosis. Right? There's lab work that can be done. If you've ever heard of the troponin, that's not a medication. That's a lab work that can be sent. There's a CKMB lab that can also be sent. All these things will be elevated if you're having a heart attack. Okay, and just lipid panel. I've spoken about blood sugar labs, hemoglobin A1C, your renal function. You can also have a stress test, right? Put you on a stress on a machine, all right, and see if you can recreate the symptoms, etc., etc. So there's a lot of things that can be done as of late. You could do a CAT scan of the coronary vessels, right, which is called a CT coronary angiography, and a lot more things that can be done. But don't take chest pain lightly. Okay, you might need to be on the nitroglycerin under your tongue. You might have to be on an aspirin, right? The statins we've spoken about. Okay, beta blockers I've spoken about. Okay, that reduces the oxygen demand of the heart muscles. Calcium channel blockers. There's a lot of medications out there. Just talk to your docs, and docs, please talk to your patients, right? Sometimes you have to end up having surgery, whether it's what's called a CABG, coronary artery bypass grafting, or percutaneous coronary intervention with stent placement. All these options are out there. I don't know if that's available in Dominica per se, but I want you guys to know that prevention is better than cure, okay? So lifestyle modification, stop drinking, stop smoking, go on diets, try to do some exercise, manage your weight, okay? Let's get that high blood pressure under control, that diabetes under control, right? Your lipids under control, like I spoke about the LDLs, etc. All right? So it remains, angina is a clinical warning of underlying heart problems. So don't take it for granted, all right? I just wanted to put that out there, put the proper terminology and what can be done if you're having this type of symptoms, all right? I'm Dr. Dale Dangleben. Have a great day. Peace.